Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. We are from group TQC1 and today we would like to present the topic that we choose is the issue of long-term effect of COVID-19 in Malaysia. But first, let me introduce me and our group members. My name is NURFATINI binti KASSIM 1181618. My friends is NURUL Izzah binti Jusoh 1181620, RAIHANAH binti MAKSOM 1181632, and also HAZIRAH binti Ja'far 1181635. Our topic is long-term effect of COVID-19 in Malaysia, and that have 4 subtopics that related to the main topic, which is what the long-term effect of COVID-19 in aspect of mental health, physical body, multi-organ, and also antibody. The first is a mental health. When talk about virus COVID-19, the words of quarantine and self-isolation is the word most of we heard, and that can hurt one's mental health. There are a few issues regarding mental health, such as hallucinations, paranoia, and depressions. The first is hallucinations. Hallucination is a sensory perception such as a visual, picture, or sound that happens in the absence of real external stimuli and is frequently caused by neurological problems. When the person is mentally unstable with that situation and feel loneliness, from that the hallucination will appear as accompany to him or her. Next is depressions. There have been a lot of cases of this that lead to depression as their main cause. Depression is about a person's disorder that causes him to feel long suffering, exhausting, lack of energy and anger, and loss of interest in daily activities. These symptoms of pandemic COVID-19 will be affected to the people whether they are patient of COVID or not. All the problems will lead them to overthink, and that is cause all the symptoms that related to the brain.
Okay, the second long-term effects of COVID-19 is against the patient physical. There are some of the most common symptoms experienced during the recovery phase of COVID-19 infection, among which are shortness of breath, fatigue or extreme tiredness, and chest pain. The first effect on the physical is a shortness of breath. People who are healing from COVID-19 frequently experience shortness of breath because of clotting activity driven by inflammation. This blood clots occurs in the small vessels inside the lungs and hearts and cause carrying in the lungs, which can impair lung capacity and restrict blood flow. The second effect is fatigue. It makes the survivors extreme tiredness to continue their activity. It could last around 2 to 3 weeks depending on severity of COVID-19 infection. So the survivor must maintain their health and reduce fatigue symptoms by managing fatigue properly between prioritizing. And the last effect against the physical is chest pain. This happens due to the virus hurting their muscle, which is chest muscle. And the chest muscle requires for breathing become sore and creating pain in that part of the body.
First of all, let me talk about the coronavirus give many effects on the multi-organ on every human body that have been infected. It has a long-term adverse effect on the internal organ as the structure of the organ changes from the structure before being infected with this virus. Since COVID-19 virus is an infection of the respiratory tract, the most significant and serious long-term effect on human body organs recovered from COVID-19 is the lungs. It causes the lungs to be so difficult to transfer oxygen from the air into blood. This virus can also cause half of the lungs to malfunction, which is expected to remain forever or impossible to recover as usual. Furthermore, these former COVID-19 patients are also more likely to have heart attacks as a long-term effect on body health. This happens when the virus causes inflammation in the heart when the patient is infected. This can also happen to former COVID-19 patients if they do not have a history of heart disease or other illness before being infected with COVID-19. Most of the heart damage caused by COVID-19 is believed to be caused by very small clot that block small blood vessels in the heart muscles. The long-term effects are not only on the lung and heart, but it can also affect the liver. This coronavirus will attack the liver cells, then destroy them or cause inflammation through an overactive immune system. Therefore, for former COVID-19 patients with normal damage to the livers, it may be possible to recover quickly. However, if the attack occurs repeatedly, the liver cells cannot grow back quickly, causing the livers to be damaged. Thank you.
Hi, my name is Izzah binti Jusoh. My matric number is 118162. So, the issue number 4 of long-term effect of COVID-19 in Malaysia is antibody. First of all, a lack of protective immunity is likely to be indicated by a decrease in antibody levels. In addition, the acute phase of antibody kinetics have been widely researched, but the long-term kinetics have yet to be defined with inconsistent results from previous investigation. However, the risk of COVID-19 virus infection is not restricted to individuals with chronic illness, but studies reveal that young people are also more susceptible to infection. Long COVID-19 syndrome. Some researchers have stated that patients who have been infected with the COVID-19 virus will develop long COVID-19 syndrome. These health issues are sometimes called post-COVID-19 conditions. Patients with the syndrome show symptoms directly related to the disease for several weeks and often months after infections, such as fatigue, muscle weakness, anosmia, respiratory disorder. Long-term COVID-19 can be continued for more than 12 weeks. According to the National Institute for Health and Care Excellence (NICE), long-term COVID-19 can continue for more than 12 weeks. However, in certain circumstances, people believe that the symptoms will continue longer than 8 weeks. Antibody level rapidly drop following vaccination. In today's culture, the vaccine is widely questioned as to whether it is necessary to combat the COVID virus in a long term. From recent research, data showed that 1 month after the second dose of vaccine, antibody titer reached a climax and dropped rapidly. The findings may differ because of basic variables such as vaccination, serologic tests, and research group. However, more research is needed to determine when the best time is for a vaccination booster and whether dose adjustment should be made to account for immune suppression, age, and gender, so that the vaccine course can prevent the virus from spreading to other parts of the globe. So that's all from us. Thank you.
This is our reference. There is 20 reference that we use in this essay. Thank you for watching.